My name is Rose Gitao. I am a nephrology nurse working in Machakos County. Currently, I work in a health center that's among the lowest level of the healthcare system in Kenya. Nephrology nursing or nephrology for me, it's all about improving our prevention scope. We are doing well as a country in terms of our renal care, that is diagnosis and treatment. However, we have a loophole in terms of the prevention scope. So for me, my purpose in life is to ensure that we have a strategy on kidney disease prevention in the community that can spread from Machakos County, where I work, to the country and also to the region, as well as to the continent of Africa and to the globe. I feel that I have a solution that can help. The pilot program, it's the first ever renal disease prevention program, and I am going to illustrate how I'm doing it. At the community level, I do home visiting for the patients with renal conditions and other non-communicable diseases. I try and sit around with the family to identify the gaps so as to ensure that these patients live well with kidney disease. And I liaise with the teams in the nephrology unit, that is the renal dialysis, so that we can be able to holistically manage the patients. I do family health nursing services, whereby I not only deal with that specific patient, but I try to look around the other family members. Do they have other health issues that need my particular attention? I also work with the community health workers who are attached to my facilities. I look to reaching out to other community health workers within the county so that I may train them, for which I've started training the groups, and then I award them with a certificate of participation to empower them. Then I also give them a lesson plan, a tool which they can be able to use to give the same information to the community members. When I empower them, they are good enough to train the people because they have the unique ability to reach out to them in the groups. I have made a renal resource center where patients can have access to information related to kidney disease and non-communicable diseases. I have made a notice board that has a lot of information. All the walls are pinned with information that can assist them. Also, I have trained the healthcare workers in my facility so that they are able to know how to deal with these cases once they have been referred from the community. There is a separate screening tool where it is more comprehensive than the screening tool in the community. It has more medical terms and it has a key attached so that if a patient can answer yes to either of the 5 questions, interventions can be done so as to facilitate early diagnosis, proper referral, and management of these patients. I also do train healthcare workers at the mainstream facilities, that is the level 4 and the level 5. I train the healthcare workers, the midwives, and the general primary healthcare workers. So for the midwives, they need to understand their role in kidney disease prevention, that is the complications of renal to both the mother and the baby. My package entails details on how they can be able to stand in that gap. I also train the nephrology nurses within the level 5 facilities so that they can be able to understand that besides doing the dialysis, they have other responsibilities within the facility. I have also a package for the health management teams where I work. We hold those meetings so that the managers can understand their role, and also I involve my sub-county and the county level management, whereby with the support of the CEC Health and the Director of Nursing Services, as well as the Chief Officer of Health, under the governance of Her Excellency Governor Wavinya, we are able to collaborate and they are able to support me to ensure that this pilot project runs successfully. I want to train the policymakers in this county so that they can understand the unique nature and the demands of kidney disease, so that they can be able to assist us when having the information about the condition. I want also to use the opportunity talking to the policymakers to encourage them to use their influence in the grassroots so that they can be able to rally the people into taking up the national health insurance cover so that they can be able to benefit from the universal health coverage, because it is the only way to make our healthcare system improve. And with that, we can be able to achieve a better renal care. I also have some extra duties where I do social media. I do teach both online and offline. I meet people in groups and I teach them about kidney disease just to create awareness. I teach on my WhatsApp, my Facebook, and I also have a YouTube channel where I also extend the conversation there. I'm also a friend of the Renal Patient Society Kenya, where they have a support group online, and I am the nurse in that forum. I listen and try to understand their day-to-day lives as they share their experiences, and where I'm able to assist in terms of answering their queries. I also am a friend to the Non-Communicable Disease Alliance Kenya, where I also advocate for the rights of the patients living with various non-communicable diseases in the society. I look forward for a society where we are all going to make this paradigm shift from improving only on diagnosis and management, but rather taking a step backward to look into the prevention scope, because prevention is the way to go. And I always say that we can never lose this war if we use prevention strategies. We will always win if we do it. We will not do things in our usual way and expect different results. We have to look on how we can strengthen our disease prevention as a whole so that we can be able to avert the predictions that we are having, that by 2030 we shall all be relating closely to people with various non-communicable diseases, to include chronic kidney disease and others. So I look forward to get support from both local and international agencies so that I can be able to move this vision to the best level that it can get. Thank you.